half pain is gone once the doctor is very polite with you.
One piece of advice to younger generation who are adopting this field or any other field.
Don't run after money. Be more perfect in your work.
So sir, what is your favorite type of surgery?
I enjoy doing difficult cases.
When dealing with complex cases,
Yeah.
what matters most?
You need to be calm and very much diligent that how should I approach my case.
What factors you look out for in intraocular lenses so that you can incorporate in your practice?
You have to strike a balance between the two. Good vision to the patient as well as it should not be too hard on patient's pocket.
How can podcasting add value to this field?
You cannot live into your cocoon. You might be doing the best of the jobs, but unless until you're not vocal, nobody is able to recognize you.
Sir, welcome on this show. Sir, the concept of this show is I want to share ophthalmic stories. Every ophthalmologist has a unique story. So, sir, in this episode, I want to share your story. So, sir, in the first place, why did you choose ophthalmology? And did you think it was the right choice for you?
Good morning, everybody, for having me with you on this podcast. Today, you asked me a very pertinent questions of all new ophthalmologists, all postgraduates who are opting ophthalmology. As far as my journey is concerned, I started off always wanted to join some other specialty, but many things are not in your hand. So ultimately, because I want a branch in which I can have a microscopic experience as well as patient-to-patient interaction, and so the in-between path is always an ophthalmology. So that's why I opted for ophthalmology. That is the basic reason why I opted for ophthalmology, because I want to have an in-between path of microscopic experience and patient's interaction, because there are many other specialty in my medicine field where you can only have a patient experience, or you can have only microscopic experience like microbiology and pathology. So in between path is always ophthalmology. That is the reason basically I opted for ophthalmology.
So sir, you are having more than 20 years experience in ophthalmology. तो सर जब आपने पीजी की और आज की पीजी में सर व्हाट इज द डिफरेंस?
In our time, what I can tell you that at that time we have lot of camps which are now totally abandoned, and in a medical colleges, especially government medical colleges, because treatment cost is more affordable.
Right.
So exposure of a postgraduate is much more higher than a present scenario. First thing. Second thing is our teachers are also very much keen in imparting the knowledge. Once the teacher, in today's time, nobody is having time, especially as far as teaching is concerned. So postgraduates are joining the post-graduation course and they are leaving it raw, more or less raw. Few institutions, this principle is not applicable to all medical colleges. To few it is applicable, that they are having good surgical exposure, but I personally feel majority have more or less, they are getting in and going out as a raw postgrad, as a raw doctor, I should say, and they have to have some training program to be proficient surgically. Because my field it's a mix of surgical and clinical thing. So you need to have a surgical exposure. You cannot totally rely upon you can say just a medical part. That is a basic thing. So in our time we had more surgical exposure because of camps and too much of keenness of our teachers imparting knowledge. We have so many theoretical classes. We have to attend classes with undergrads. We have to have seminars. We have to have case presentation, journal club discussion in a week. So we have 4 or 5 classes. But I don't think so. Today's time, we are seeing much with the newer generation of postgraduates. That's some basic difference.
So, sir, other than technical know-how, like as a doctor, as an ophthalmologist, surgery is the skill you are perfect at. What are the other skills young PG students should adopt so they can become a better ophthalmologist?
You know, in any practice, I always guide my youngster friends, I should say friends, who are coming to me. I always tell them that there are three principles of practice. One is A, B, and C. First is availability, the second is behavior, and the third is competence. You can be too much competent if your availability and behavior is not good. You are zero. You are available, your behavior and competence is there. Again, that is poor. So basically, you need a conglomerate of all these three. You cannot totally rely upon one. Basically, it's, you know, triangle. You need a balance of three. They all in equal harmony is a best combination rather than excess of one. If excess is there in one and other two are lacking, I don't think so you can survive in today's time. You need balance of three: A, B, and C. Availability, behavior, and competence. This is a key to success. Apart from just being good surgeon, just being good doctor. So your behavior with your patient should be very good. You know, you must have heard in our elderly people saying to us that patient का आधा दुख तो डॉक्टर से बात करके ही खत्म हो जाता है. If your behavior is not good with the patient, I don't think so. Your connection is broken with your patient. Your patient has walked into your OPD, his 50% pain and suffering is psychological. So that is relieved. Rest, you are expert in dealing with. This is my personal advice to newcomers, that they should behave and go in this way in their life, and they will definitely succeed.
So, sir, what is your favorite type of surgery?
You know, basically I am a comprehensive ophthalmologist, and basically being a comprehensive, I am doing cataract and all other kind of surgeries. But I enjoy doing difficult cases. Simple cases everybody is doing, but I enjoy doing difficult cases. Those who are denied by others, I try to take it, though risks are very high, stakes are very high, but after counseling, we love to do them. And especially they fall in cataract, all those who are terminal patients, you know, they need, you know, a patient who is walking into your OPD, two person accompanying him or her to your chamber, and after the surgery, patient is walking happily without any assistance. The kind of satisfaction a surgeon is having, I don't think so anybody can else give you that satisfaction. Anything, any materialistic or non-materialistic thing in your life, that is the best satisfaction you have. A patient walks out of your OPD with no help, and he has walked with too much of help into your OPD. That is the best thing.
So, sir, when dealing with complex cases, what matters most, attitude or technique?
You know, first and foremost, you need to be very calm. There, you're both, what we say as in Chinese people, you say Zen Zhang, both work there. You need to be calm and very much diligent, that how should I approach my case. So, you know, you need, your approach should be very, if this thing going to happen, there are many surprises which happen on table which you cannot predict prior to surgery, but you need to be very calm and diligent. So basically, you are walking on a, I should say, sword. You know, you can fall the other way, by which you can harm yourself, and you can fall this way, by which you can benefit the patient. So it's just like that. So basically, you need to be both diligent and calm. Yeah.
So, sir, if you want to sum up this all, I would like you to say one piece of advice to younger generation who are adopting this field or any other field, who are aged between 20 to 25.
2-3 things. First is ABC. I cannot sum up it in one, so I will say 2-3 things. ABC, availability, behavior, and competence. This is the key. And the second thing is, don't run after money. Be more perfect in your work, which you are for which you have opted for. You know, if you want to run after money, then medicine is not good for you. You know, the key to success is make yourself perfect so that money should follow you rather than you following the money. This is the only thing which I guide my younger generation. So whensoever you join anywhere, you should have ABC of practice in your mind and don't follow the money. That is the key to success, I personally feel.
So, sir, these are some of the questions of patient. Should you wash your eyes with salt water?
No, I don't personally think that anybody should wash their eyes with salt water, because salt will lead to dehydration, and that is not recommended otherwise.
That is not recommended.
Not.
So, sir, there are girls who put cucumber slices on the eyes. So, sir, can cucumber slices improve your eyesight?
No, it's a myth. Cucumber can never. It is a eatable thing. Rather, it should be put into mouth rather than on eyes. It should not be put onto the eyes. There are, God has gifted us artificial tears there to wash off your eyes with all the infections. We don't need any supplement. At the most, what you can do is you can put on cold compress, commercially available, or you can say economical at home. Dip your cloth into cold water and keep onto your eyes. That is the most economical thing, or you can have a commercial kind of thing. That is one's wish and pocket. This is I personally feel.
So, sir, there is one more question. Can I sleep with eye makeup on?
No, never. When you are already exposing yourself to such chemicals, we have silica into them, which has been procured. So once you start using them throughout day as well as night, during sleep you might rub your eyes. That can cause harm. So it damages your meibomian glands, and it can later on leads to chronic blepharitis as well as meibomianitis and dry eye. Today's time we are already seeing dry eye to the tune of 70% according to recent studies, mild dry eye. So why we want to augment it further? And screens have inculcated into our daily lifestyle like anything. Why want to enhance it further? So no eye makeup at bedtime.
So there is one more question. Do cataract surgery take hours?
It's a very individualistic thing. I should say, as a younger postgraduate student or as a fresh candidate post PG, you might take quarter to an hour. If some complication have happened, it might take more than that. But experienced surgeon must not be doing, well, I suppose 5 to 7 minutes per case. So surgeons we do have having records of doing 10 cases in an hour or so, or 12 cases in an hour or so.
Sir, there is one more question. Can contact lens harm your eyes?
Contact lens is nothing, though we have contact lenses with the various grades of hydration in them. Our basic principle, we should always know that oxygen to the cornea is withdrawn from the air. Once you are cutting up off that oxygen by contact lens, it is inevitably leading some micro damages to the corneal epithelium as well as cornea. If you are putting in your contact lens 24/7, you are increasing carbon dioxide level. That is going to lead to lactic acid, and that is going to lead to lactic acidosis, and that leads to corneal edema in the early morning if you have slept with CLs on. So I personally feel contact lens should never be put in for more than 12 hours in a day. And if you have a habit of sleeping in afternoon, again, you should remove them and re-put in the evening hours.
Okay. So now let's play a interesting game by the name of diagnosis dilemma. So sir, मैं आपको एक statement दूंगा. You have to guess what's your diagnosis in that. A 42-year-old banker complains of frequent headaches, blurred vision after reading, and difficulty focusing on near objects. So what's your diagnosis?
Instant diagnosis in such patient will think about, because his age is such a thing which always points towards presbyopia. Basically, it's an age-related diminution of vision for near work. So presbyopia.
So it's presbyopia. So second case is a 30-year-old IT professional reports eye redness, dryness, and a burning sensation, especially after long screen hours. What's your diagnosis?
in today's time, screen time has become an integral part of everybody's life, and this is called as computer vision syndrome. It will, in which you will have everything like this: redness, irritation, watering, photophobia, induced myopia, which will go off with time. But my diagnosis will be CVS, computer vision syndrome.
Computer vision syndrome. So third case is, and it's the last one, a 10-year-old child sits too close to the TV and squints while reading and struggles to see the blackboard also.
Definitely refractive error.
Okay.
Because the age is, again here the age is a number, because so age history taking is a very important thing. So age is a number which can, by which you can clinch the diagnosis. So definitely refractive error. It could be myopia, it could be hypermetropia, or it could be because he is squinting as well. So with additional pathologies like accommodative squints. So it's a cumulative of two: refractive error with accommodative component. Yeah.
As you are a single practitioner and in private practice, sir, there is a rise in corporate culture in ophthalmology. So, sir, how do you differentiate yourself from the corporates?
You know, again, as already mentioned, that in solo practice versus corporates, you know, there is no humanly touch by them. You know, a patient walking into your OPD, I just already mentioned that your half pain is gone once the doctor is very polite with you. You know, so a humanly touch with the patient, and genuine rates. These are the genuine. I suppose you are doing your job, just not rates, doing your job genuinely, not pushing it too hard. These are the key to success to a private practitioner, by which he can make his or her own brand in this competitive world of corporates and other people.
Right.
So I personally feel a humanly touch and your genuineness to the patient, guiding him properly, is the key to success. Is the key to success. Definitely, though the path will be longer, but ultimately, marathon is that this is a marathon, and you need to be patient. You need to be patient. You cannot think this way that, you know, there is a very common saying which I sometimes share with everybody: short-term gains are short-lived.
Yeah, right.
Short-term gains are short-lived. You know, many corporate will come and go, but ultimately the one who is consistent will stay.
Yeah.
And I have seen at my place that many corporates have come, had come, are coming, and many have come. Those who had come had their business for 2-3 years and then winded off and gone back. So it's, I personally feel consistency is the key to success.
Consistency.
Your behavior, consistency.
And sir, as a surgeon, you incorporate IOLs in your practice.
Definitely.
So, sir, what factors you look out for in intraocular lenses so that you can incorporate in your practice?
You know, two things basically in this again. One is patient's need, and the second is patient's budget. You cannot have patient is totally non-affordant. How you can counsel him or her for a premium IOLs?
Right.
So you have to give. Again, it's a, you can say it should be, you have to strike a balance between the two. You know, good vision to the patient, as well as it should not be too hard on patient's pocket. So these are the basic two factors. So if plus patient's profession. If sometimes patient walk into your OPD listening from here and that, I want a multifocal and I want a EDOF, something like that. But patient's profession is such, or he is too much demanding, or he is having family history because of which he is not able to fall into those premium IOLs. I think it's better not to advise them. There is no need to burn your fingers later on repenting for your decision that, or sometime if something, you know, hanky-panky overtakes your mind, it's better not to burn your finger, rather than say no to the patient, I am not doing it. So it's better strike a balance.
So, sir, there is a patient selection criteria for that premium IOLs?
Yeah, definitely.
So there are different kind of IOLs like EDOF.
Pocket wise, I have already explained, if a patient is having premium IOL selector, then your problem is solved for advising the lens. So in those patients, then you need to see the medical condition.
Medical condition.
Like patient is too much demanding. This is non-medical condition, but you have to look into it. Second thing is you one-eyed patient, post-uveitic, post-glaucomatous, diabetic, those who are having some retinal pathologies, they should better be, counseled for monofocal premium lenses rather than some EDOF or multifocals. This is my.
So, my last question to sum up this podcast is, so there are two kind of manufacturers, one are Indian and one are imported, and there is a gap between the two of them. Sir, what advice you would give to an Indian manufacturer so they can come at par with the multinationals?
Pricing and good material.
Pricing and good material.
Good material. Material should be at par with the international thing. That is the basic key to success. Definitely Rome cannot be built in a day. So pricing definitely we'll have to keep low because we are in India. Our manufacturing part will be less expensive. So pricing, and the second thing is material. Now we have to work only on material part,
right?
And with less of post-surgical surprises for the doctors. So that means we have to refine our manufacturing up of IOLs. That's the only thing, and material part. That's it. Pricing definitely nobody can beat us because once you are in your own country, what are shortcomings, what are the points which we have to look for as far as pricing is concerned. Now we are only left with one thing, that is material and post-surgical surprises. That's it.
And sir, podcasting like this, how can podcasting add value to this field? It's your feedback for me so that I can improve.
This is a digital world. In today's time, everything is, you cannot live into your cocoon. You might be doing the best of the jobs, but unless until you are not vocal, nobody is able to recognize you. So I personally feel you have to sometime come out of your cocoon. It's not for you, it's for me also. Or something like, who is always living into one's cocoon must be doing best of the best things, but don't want to be out. But now I have recognized it, that we have to come out of our comfort zone and come out of our cocoon, that we are doing the best. But we need to know, we need to apprise of general public and by and large our fellows and friends that we are also doing good. You should not be very, aggressive in that, but at least it should be a reasonable thing that for your success in today's time, because it's a digital media.
Right.
So everything is digitalized. If you are saying that I am doing this and nobody else is knowing it, and you must be doing it much better than somebody else, or those who are in market or those who are in media. So sometimes you have to make it vocal. And for that, this is the platform we should use. More.
Thank you so much, sir. Thank you so much for being on this podcast. It was a wonderful episode with you.
Thank you, dear. Thank you. Thanks a lot